Chondroblastoma by Alexis Harrell. Chondroblastoma is an uncommon benign bone tumor that originates from chondroblasts, which are the cells responsible for cartilage formation in the growth plates of long bones, such as the humerus, femur, or tibia. Um, it has been documented in companion animals such as dogs and then livestock like cattle. It's more common in young animals while the growth plates are still active. And over here to the right is just some images of what chondroblastoma might look like in a small calf. Normal bone growth, bones grow through a process called endochondral ossification, where cartilage is replaced by bone. Chondroblasts are involved in producing cartilage, which is the template for new bone formation. The tumor in the chondroblastoma tumor can lead to bone destruction and or deformation. Chondroblasts become dysregulated, forming a tumor rather than contributing to normal bone growth. The development of chondroblastoma is characterized by the dysregulation um, and proliferation of chondroblasts, which leads to the formation of a tumor composed of defective cartilage matrix. The overgrowth disrupts the normal architecture of the bone. These tumors can often result in bone destruction, swelling, pain, and lameness, with clinical signs arising as the tumor disrupts the growth plate. Chondroblasts are the normal cartilage forming cells that are responsible for producing the extracellular matrix of cartilage. Osteoclasts are cells involved in bone resorption and may play a role in the bone destruction seen in chondroblastoma. As chondroblasts mature, they become chondrocytes. In chondroblastoma, these cells do not mature. Osteoblasts are the cells responsible for bone formation, and these are the cells disrupted by the presence of the tumor. And as I previously mentioned, the chondroblasts become dysregulated and grow abnormally, and they then proliferate uncontrollably. Um, as far as symptoms, treatment, and therapies goes, the diagnosis is typically made using imaging such as X-rays, CT scans, and MRIs, which can assess the tumor size and its effect on surrounding tissues. Examining tissue samples can reveal characteristic multinucleated giant cells and abundant cartilage matrix. Surgical removal is the primary treatment for chondroblastoma, um, and it aims to remove the tumor and preserve the structural integrity of the bone. And when completely removed, the prognosis is usually positive, but if not entirely removed, then reoccurrence of the tumor can occur. Um, Although chondroblastoma is rare, a clear understanding of the pathways and treatment options are essential, because intervention can help prevent growth disturbances and skeletal deformities. The imaging that I mentioned, so like X-rays, CT scans, and MRIs, is not always available, especially um, if you might have the symptoms of chondroblastoma in cattle. But as far as like your companion animals go, like your dogs, you will probably opt for the surgical removal. And then if surgical removal takes place, then physical therapy is usually required post operation.